for nearly 60,000 women who are diagnosed each year, treatment will not make a difference. Here to explain it is the assistant professor of surgery at the Montefiore Einstein Center for Cancer Care in New York City, Dr. Rachel Wellner. Thank you so much for being with us.
Thank you. Good morning, Anna.
So this is called DCIS, which is really early stage breast cancer. Explain what it is.
I think it speaks to the heart of the matter, which is what exactly is DCIS. DCIS stands for ductal carcinoma in situ. What that means is that we all contain milk ducts, and there are cells within the milk ducts that are behaving abnormally. They're proliferating. However, they're trapped within the duct. So in some ways, they're behaving like a cancer, and in other ways, they're not. So what is that trigger event that turns a DCIS, or a stage 0 cancer, into an invasive cancer, which becomes dangerous for a patient?
Right, because what are some of the types of therapies that women are having who have this stage 0?
Our current standard treatments include things like lumpectomy with or without radiation, and or mastectomy, followed by anti-hormone treatment in some instances.
Which many are saying, I mean, those are brutal type surgeries, therapies that women have to go through. And are you saying that this study is not going to make a difference and maybe they shouldn't be having them?
Well, this study, essentially, just to go back for 1 second, DCIS may be a precursor lesion for cancer, and it may just be a risk factor. It's not 100% clear yet what it means. The study is indicating that it might be more of a risk factor than a precursor lesion. The study looked at 100,000 patients over 20 years and suggested that despite the treatment that they underwent, whether it was lumpectomy with radiation or without, or mastectomy, there was a 3.3% death rate in all comers. The study also teased out certain high-risk patients that had a higher mortality rate. So I think that's kind of what we're looking at, identifying those patients whose DCIS may be triggered into forming an invasive subtype, or that might recur as an invasive subtype.
And to break this down, because all of us know a family member, a sister, a mother, a neighbor, a coworker, somebody who is going through this, what do they need to know to be an informed patient? What questions do they need to be asking their doctors?
I mean, it's a good question. I think we're becoming more and more sophisticated with this. Again, looking at some of those high-risk features in this study, those were young age less than 40, African-American descent, large size of the tumor, high grade of the tumor, and hormone insensitivity. Those were some of the properties that led to higher mortality, suggesting maybe those are the patients to be more aggressive with, more lumpectomy with radiation, maybe more mastectomy in certain instances, especially if there are other risk factors that are involved. Those would be some of the questions.
Right.
But we're also learning how to tailorize treatment even more specifically with more sophisticated techniques.
So as always, we need to be an informed patient and ask our doctor lots of questions. Dr. Rachel Wellner, thank you so much for your time today.
Thank you very much.
56